Welcome back to the Dr. Ridwan Show. Today's episode is on erectile dysfunction, and we continue our discussion on erectile dysfunction. And I asked Dr. Carson, what are the causes of erectile dysfunction?
There are many, many causes of erectile dysfunction, and many of them are associated with aging. Anything that has to do with the vascular system, coronary artery disease, as we've heard, diabetes, which can cause erectile dysfunction by both nerve changes as well as vascular changes. Hormonal problems. Low testosterone is a significant cause of erectile dysfunction in American men. Also, any radical pelvic surgery, whether it's radical prostatectomy.
What is radical pelvic surgery?
Yeah, radical pelvic surgery is surgery of the organs of the pelvis for cancer. And the most common one is radical prostatectomy, removing the prostate for cancer of the prostate.
And we will come back to discuss that in more detail.
Yes, that's an important one, obviously. There are also, obviously, psychological causes and psychiatric causes of erectile dysfunction. Depression is a huge cause of erectile dysfunction. Indeed, about 90% of men with significant depression have erectile dysfunction. But there are also psychological causes, such as performance anxiety, which is what I term as like a batting slump. The people in the major leagues can hit a ball over the fence every time they get up to the bat, but for some reason, for 2 weeks, they can't hit a ball. It's the same thing for erectile dysfunction. If you can't perform one time, you're going to fail the next time.
Now those physical causes of erectile dysfunction and psychological causes of erectile dysfunction, are they mutually exclusive, or can one patient have two causes?
Virtually everyone who has a physical cause of erectile dysfunction has a psychological overlay. And so one needs to be aware of that and not just give a pill or a procedure for erectile dysfunction, but also coach, counsel, help the patient and their partner to get through the treatment, because that psychological part can be as important, if not more important, than the physical portion.
So in other words, you could have diabetes and depression. You could also have radical prostatectomy, removal of the prostate-related erectile dysfunction, and performance anxiety.
Absolutely, and anything cancer-related obviously has a very large psychological overlay. A lot of depression, a lot of concern by the partner and the patient about the patient's well-being. So erectile dysfunction in the setting of cancer and cancer treatment is almost always associated with some psychological issues.
How about relationship problems?
Well, that goes into the performance anxiety to an extent, and relationship issues are a very large portion of psychological causes of erectile dysfunction.
So maybe we will hear a little bit about the relationship issues from our guest expert, who is a psychologist, Dr. Marian Dunn. Dr. Dunn, may I ask you to explain how relationship problems can also contribute to be a cause of erectile dysfunction?
Well, relationship conflict in any form can create increased pressure on a man so that it diminishes his performance. And of course, if a partner has been denigrating or very critical, it adds to the pressure that the man feels. If there are any old angers and resentments between them, it can play out and add to erectile dysfunction. There's another thing that I've noticed clinically, and that is if the partner is not interested in sex and not responsive. When a man is younger, pure animal drive may carry him, but by middle age, that lack of response on the part of the partner is unsexy, and he has more difficulty getting aroused, and it becomes work, and it's very hard to have a good erection if it's work rather than pleasure. And then lack of trust can sometimes cause erectile dysfunction. Partners may have stepped out on each other, or there may be suspicion of loyalty, and this can add to the pressure that can interfere with an erection. And how the partner has reacted if their mates developed an illness can also affect erectile dysfunction. For example, many women are fearful if their partners had any hint of heart disease that having sex will be dangerous. And her anxiety may translate to, "Don't worry about sex, honey, it's not that important to me." And the man feels, my God, I've been making love to her all these years and she hasn't been enjoying it. But really she's trying to be protective of his health because she's confused about whether sex is safe or not. So there are so many subtle factors that can interfere with a couple being able to be intimate and comfortable and relaxed with each other.
Thank you, Dr. Dunn, very much. Thank you. Now, Dr. Musa, in terms of erectile dysfunction being caused by cardiovascular disease or related to cardiovascular disease, what is the explanation of that? Why erectile dysfunction and cardiovascular disease are so closely and so intimately related?
The reason is really simple. Whatever causes coronary heart disease specifically causes erectile dysfunction. And the cause is that there's a plaque that accumulates inside the blood vessels that perfuse the sexual organ or perfuse the heart. So when we talk about vascular disease, we mean plaque that accumulates in the arteries and obstruct the blood flow, in this instance to the penis, or to the heart, could be in the same patient. There's risk factors for the plaque accumulation. These risk factors are diabetes, a big one, hypertension, high blood pressure, high cholesterol. Obviously, smoking is an interesting factor because smoking is related more to peripheral arterial disease, a little bit less to coronary heart disease, and it could be also related to erectile dysfunction. But it's on its own, it's not as important as in combination with the other risk factors. Diabetes is important specifically because also it affects the peripheral circulation. And I think the relationship between erectile dysfunction and peripheral arterial disease is much closer than with coronary disease. Because when there's vascular disease, it involves the arteries that go from the iliac artery in the pelvis to the sexual organ. So almost every patient with peripheral arterial disease, they have probably risk of having erectile dysfunction because the plaque could involve those arteries going to the sexual organ.
So for our viewers, peripheral artery disease or peripheral vascular disease is basically the disease of blood vessels in the legs,
in the pelvis,
and
the leg,
and in the legs.
Correct.
Now, certain populations in the world who have very high incidence of vascular disease and heart disease are also expected to have a lot of erectile dysfunction. I would suspect certain...
Sure. Yeah, I mean, for example, if we talk about diabetes, obviously in the Middle East and the Gulf states, their diabetes could be, I think, 30-40% of the population. I mean, here when we talk about diabetes, it's 30% of patients with coronary heart disease. But there it's 30% of the general population.
Of the general population.
Of the general. So that tells you how epidemic that is. Other countries, such as Russia, for example, also there's higher prevalence of peripheral arterial disease and coronary heart disease. Combination of, again, could be sedentary lifestyle, also prevalence of other risk factors, hypertension, obesity, etc. Obviously, there's other countries that those factors also prevalent, but those come to mind.
So, diabetes and erectile dysfunction. Why is diabetes so special when we mention erectile dysfunction?
Because diabetes causes severe vascular disease. Really, it's as simple as that. There's a lot more blockages, a lot more severe blockages that obstruct blood flow. And that's why these patients don't respond to the medical therapy.
So men with erectile dysfunction and diabetes have more severe erectile dysfunction than the general population of men with ED?
Correct. I mean, that summarizes the issue. And again, so they have both more severe vascular disease leading to more severe erectile dysfunction. That's severe in terms of on the scale of erectile dysfunction that don't respond well to conservative medical treatment.